Oh, well, I appreciate that. Yeah, we're trying to learn as we go too, and it changes a lot, But were you at Mount Sinai? Which one did you go?
Mount Sinai.
Yeah, that's where we went.
Yeah. Well, I tell you, I was really proud to go there and be alongside Mayor Zoran Mamdani. I'm the former chairman of the Health Education Labor Committee. And I'll tell you, Theo, I have met with nurses all over this country. I love nurses. It's no great secret that our healthcare system is broken. Everybody knows that. And the people who are keeping it going are, in fact, the nurses. They're with you when babies are born. They're with you when you die. They're with you in between. They're at your bedside. They're the backbone of the healthcare system, and I love them. And I'll tell you something, time and time again, nurses would come into my office, and they'd start talking, and suddenly they'd start crying. And you know what they were crying about? They were crying about the fact that they were unable to do the jobs, to do the work that they were trained and wanted to do, that they didn't have the number of nurses they need, the staffing ratios that they needed. They broke down. And I was just a couple of years ago, not dissimilar for what's going on in New York City right now in New Brunswick, New Jersey. These nurses went on strike. You know why they went on strike? Because they needed help. To provide better patient care. It wasn't even about money.
Right. They're just saying, hey, I can't even be a nurse. This is my calling in the world, and I can't even do it to a decent potential.
Exactly.
And it's tough enough. We talked last time about patients being stressed to the gills, not only dealing with their physical ailments, but having to deal with the stress of begging for insurance companies to support, just all of that. And now you're going to put the nurses under the same stress.
Exactly. It's pathetic. And I'm sure you know this, the CEOs there of these big, huge hospitals. One guy is making $26 million a year. Another guy, I think, is making $16 million. Another guy making $5 million. They're bringing in all these traveling nurses, spending hundreds of millions of dollars rather than sitting down and negotiating a decent contract with these dedicated nurses. So there they are. You got them up there, huh?
Yep, and I'm grateful. I want to just mention these wonderful CEOs by name today, just so because look, it's time where we put a name with people who are making certain choices. And so we have Brendan Carr. I know he's over at Mount Sinai. Brian Donnelly, there he is. Look at that big smile. I'd be smiling too if I just made $15 million this year. That's Philip Ozua, who looks like a Guess Who character, and Stephen Corwin from Monopoly. I don't know. That's alleged. These are the CEOs current, and I think one is just leaving the one of his posts. These are who nurses are asking for help from.
Right.
Is that right? And just to be clear, Bernie, what are the nurses asking for?
What they're asking for, what they call safe nurse-patient ratios. That means if you're a nurse on duty and you have too many patients to take care of, you can't do your job.
Yeah.
A patient calls out, needs your help, you can't get there. So they want more staffing to be able to provide the quality care that patients deserve.
Mm-hmm. And I know in addition to that, I think they wanted healthcare benefits not to be cut.
Right, for themselves, right.
Which is if you think that nurses
pretty crazy, huh?
Can't get healthcare. They can't be sure that they're going to have healthcare. They're working with the sick. We can't say, hey, we're going to do our best to make sure you don't get sick.
That's pretty crazy. And the other thing they're worried about, and I hope we can discuss this a little bit, is AI and robotics. They've raised that issue as well.
Have they really?
Yeah. And there was a Dr. Oz, who's head of CMS in Washington right now, was talking the other day. Let me get it straight. I think it was Alabama, rural Alabama, where they're weak on the number of obstetricians that they have. And he was proudly talking about how they have robots now who are providing examinations for pregnant women. Yeah.
And who's controlling those robots? It's not some pervert at his house, huh?
Well, but the point is, if you're a patient, do you really want a robot examining you?
Right.
So, I mean, I think all of this, Theo, adds up to the fact, and I'll tell you, I've been all over the country, and wherever I go, I talk about this. Whether you're conservative, you're moderate, you're progressive, you understand the healthcare system is broken today.
Yeah.
We are spending, this is insane. Do you know how much we spend per capita? Add everything else, right? Medicaid, Medicare, what you pay out of your own pocket. How much do we spend per person on healthcare in the United States of America? Do you know? Take a wild and crazy guess.
Per year?
No, per person.
Oh.
Per person.
Okay.
$15,000 per person.
Okay.
So a family of four spends theoretically $60,000.
Oh, wow.
That is double what any other country on earth is spending. You got it?
Yeah.
You would think that if we are spending, if I buy a $100,000 car, you buy a $50,000 car, my car should be a little bit better than your car, right? And yet, despite all of those expenditures, our system is worse than others. We're the only major country not to guarantee healthcare to all people.
But it's because there's these kind of like darker agreements between hospitals and insurance companies, right? And the cost of drugs.
Yeah. It has to do essentially, look, in this day and age, running a healthcare system is very difficult. Technology changes. It ain't easy. I admit that. But what is the goal of a rational healthcare system? It is to say, first of all, to answer the fundamental question, is healthcare a human right? What do you think? Should everybody, regardless of income, get healthcare?
I believe that based on how much money our country has, I think it's wrong not to provide that to